Welcome back to the High Five web series, where we bring healthcare experts to you to answer a few questions about key policy issues. I'm Sue Bowman, Senior Director of Coding Policy and Compliance for AHIMA. AHIMA is a proud sponsor of the Gravity Project, so I'm very excited to have with us today Sarah DeSilvey, Terminology Director for the Gravity Project. Sarah is also a founder of the Gravity Project and a practicing family nurse practitioner. Thanks so much for taking time out of your busy schedule to join us, Sarah.
Thank you. I consider AHIMA a dear, dear friend and colleague in this work, and it's my honor to be here with you today.
Thank you. So first off, could you provide a brief overview of the Gravity Project and its mission?
Absolutely. So the Gravity Project was an HL7, Health Level 7 Fire Accelerator Project, which means that we are a special project of HL7 that has the mission to develop data standards to address the social determinants of health. We were founded in 2019, really based on an international consensus that although social care practices, social determinants of health were well known to participate in health, there's that famous image that shows that over 80% of our health outcomes are not associated directly with healthcare activities. We did not have sufficient data elements or standards to represent the things that we knew were driving outcomes. So in 2019, the Gravity Project was kicked off in partnership with Robert Wood Johnson Foundation, the University of California, San Francisco Social Intervention Research and Evaluation Network, or SIREN, and EMI advisors to basically develop a pathway to fill that gap. Right, so over the course of the last 6 years, Gravity has been convening over 2,000 members of the community ecosystem, evidence-based technical expert panels, driving development of solid data standards to address the social determinants of health. And that's the terminology side. That's the side that I lead as the Director of Terminology. In addition to that, because we are HL7 Fire Accelerator, we also work to develop the pathways for exchanging information between the clinical entities and social care entities, because you cannot address social determinants of health and social needs without participating, centering, and involving the expertise of community-based organizations and human service and social care experts. So that involves breaking down the silos of the healthcare-centric standards and interoperability standards, and ensuring we have the capacity to move information in patient-centered ways across both clinical and social care members of care teams. I think that was a good answer.
That was great. That was great. So what are some of the key accomplishments over the past year that Gravity Project has had?
Well, if I sit here right now, so it's the early summer in 2025, a full 12 months has a host of different accomplishments across the Gravity work streams and Gravity ecosystem. So as I mentioned, Gravity Project, the Terminology Division, we create evidence-based data standards to address social needs, social risks, and protective factors, the social determinants of health. Long ago in our origin story, we developed value sets and data standards to name food insecurity, housing instability, homelessness, inadequate housing, and transportation insecurity as our core 3 domains of reference. So we have data standards guided by evidence across standardized instruments, diagnoses, patient-centered goals, and all the core interventions that matter, everything from WIC to HUD housing programs to non-emergency medical transportation. We build codes for all of it and have the standards that guide it. So over the last 12 months, there's been significant advancements in referencing those standards for national initiatives. A pretty critical example of that is the NCQA, National Center for Quality Assurance, Social Needs Screening and Evaluation Measure that came into reporting in 2024. So in 2024 was a huge year of measured entities, payers as part of the HEDIS quality measurement system, building in pathways, leveraging Gravity standards to meet that quality measure. And so we saw a significant shift and acceleration of the implementation, adoption, and use of Gravity standards in health records to support that quality measure, in payer systems, in clinical systems. So that was definitely one of the most significant advances we've seen in the last 12 months. In addition to that, we started another massive acceleration of dissemination project. We started our initiative with states on working towards supporting things like Medicaid 1115 waivers in addressing social needs. We have a intentional relationship with the state of New York on their waiver, which just went in live at the beginning of this year in January. We also are, referenced in other federal regulations and policies. And I think internally, something that we've done that I'm very proud of is work with entities like AHIMA. I'm going to center you on ensuring that we have all of the resources necessary to facilitate that adoption and use of our standards, right? So we've worked on a massive resource library that includes information on how to apply gravity-developed terminology like IC10-CMZ codes, or reference core national instruments like the Accountable Health Communities Health-Related Social Needs Tool. AHIMA participated very, very closely in the development of that guidance, and all kinds of additional guidance, webinars and resources available on our public confluence so that all entities in the country can kind of pick up our standards and apply them to use. And that's all in terminology. And then existence in tech. We just updated, just today, we released our next version of our implementation guide, which aligns with US Core, and we're continually having enhancements in that area as well. And I'm listing a lot of things because Gravity is doing a lot of stuff. We also, our members led a payment and reporting discovery on steps that are needed to drive payment reform to facilitate decreased burden in like social care organizations submitting claims aligned with social needs. There's just been so much activity in Gravity. As you know, things are always happening, but those are, I think, the biggest things I could say over the last year.
That's great. And yes, Gravity does do a lot of stuff.
Gravity does do. Well, we do a lot of stuff together. Gravity is big, and you are part of it. And there's a lot that we get done. Yes.
And we're happy to partner with you on a lot of those projects. Yes. So switching and talking a little bit about the terminology work in particular, how are the social risk domains for the development of data standards selected? And what are some of the domains the Gravity Project is focusing on this year?
That is a really good question. So we are, if we are anything, nerds at Gravity. So every bit of terminology that we develop has to be aligned with the evidence, both on whether it comes to priority and picking it, and how we build each concept, right? Because the initiative, the whole purpose is to enable documentation of needs and interventions that matter, right? So the bulk of evidence over the course of many decades precedes us. So all of that evidence comes to bear through every single step of the way. The first step where it comes into play is in how we pick, right? So we have a kind of matrix that we think about when we think about domains in the pipeline. We look at things like Healthy People 2030. We review the literature. We think about member needs, like members come to us and identify things that matter to them. We think about things like the National Academy's capturing social and psychological data in electronic health records papers, the 1 and 2, like foundational evidence on what we need to capture and why. So we synthesize all of that evidence and all of those member needs to create a list and a pathway towards what we can name and how. And then members prioritize, right? So we have a really robust membership that includes members that sponsor our work through financial sponsorship akin to the HL7 Fire Accelerator model, but also designated members representing patients and community-based organizations. And they basically run down that list of evidence-based priorities, and they run down the list of their own personal priorities and set a pathway for us to work through in terminology. So suffice to say, really nerdy. We really try to make sure that we have the data elements to support every goal in the Healthy People 2030 goals and every goal aligned with any major national initiative or regulation. And then we center members along the way as well. So that was the first part of your question. The next part of your question is actually pretty exciting. So we are just about wrapping up our current, domains that will finish in May. And we're looking ahead to a fall that really has us shift and evolve into neighborhood level domains and community domains that matter. and directly influence patient outcomes in the realm of social determinants of health. So as, for instance, we addressed food insecurity as a household concept in 2019. That was actually our first domain. So in the fall, we're thinking about how households and individuals interact with their community in a way that matters. So addressing things like food access. Is there sufficient access to healthy and nutritious foods in the environment and neighborhood where that person is living? And we're looking into concepts like access to green space and physical activity and wellness. Like, are there sufficient open green spaces that people are able to recreate in and gather in and commune in, right? So all concepts like that of the neighborhood surround household level concepts to really bear out the outcomes we know are related to the social determinants of health. So we're very excited to look into that. And they're also interrelated. We're going to be addressing neighborhood safety in addition to access to green space. And the amazing thing and the evidence is you build more green space and access to places where people can recreate and commune, neighborhood safety improves, right? So we're very, very excited to look into those concepts. And, health systems have been investing in these concepts for decades now. And so we're excited to build the terminology to support them.
That's great. I know I've been surprised at some of the many different things that are considered social determinants that actually affect people's health outcomes. It's very, very exciting work.
It is so exciting. Yeah.
So let's talk next about a brief the Gravity Project developed this year titled Best Practices for Validating and Documenting Social Diagnoses. Why was this brief developed, and how can it help healthcare providers and organizations improve the documentation and coding of social risk factors and needs?
I am going to answer this question. I'm also going to honor the fact that you were one of the principal authors. So I can state that Gravity is in a unique situation where, because we are developing standardized terminology, and because we are therefore creating a proliferation of robust standardized instruments with exactly matched ICD-10-CM diagnoses and SNOMED CT diagnoses, we find ourselves in a situation, and we have all of our principles and ethics. We haven't mentioned yet Gravity's principles for data use, which preventing, reducing, and remediating harm is a core principle of ours when we work within our social justice framework. So because we have this very careful, thoughtful analysis of questions and answers, and the ICD-10 diagnoses concepts that match, we are in a position where you can imagine this auto-generating of diagnostic concepts, right? Because we designed this ICD-10 and SNOMED concept to exactly match this instrument because that matters, right? It's very unique. And so you can imagine where you could auto-encode, but then you start to bump up against a few core principles that we have within Gravity as well, which is patient-centeredness and that assurance of preventing, reducing, and remediating harm. So I remember I reached out to our friends who are expert in the principles and ethics of diagnosis to really kind of clarify how we can leverage the capacity of our technical solutions, center our ethics and principles and diagnostic, standards, right? And ensure that we arrived at a common goal. So with that, the brief was really created to define the pathways and principles and practices when you are sitting with the capacity to auto-encode, how to center patients and verify diagnoses, and then how to leverage technology without upending our principles. I hope I did a pretty good job of answering, Sue. I hope anything else to say about the brilliant brief that you helped author, because I'm gonna center you back. Anything else that I should
Thank
add?
you. Did a great job describing that, and AHIMA was thrilled. We were thrilled to be part of developing that brief, and happy it's available, because as you know, the risks of people thinking they could just auto-generate codes without any kind of conversation with the patient or ensuring appropriate documentation in the medical records was a big concern of ours, that we wanted to make sure people were following the right processes and workflows and not taking inappropriate shortcuts. And we've heard from a lot of our members that they're very happy to see this resource out there, not just for their own use, but for other people within their organizations that may not understand the reasons why that might not always be a good idea to map directly to a code without going through the other appropriate documentation and clinical aspects.
100%. And I think one thing that you and I can speak to, because again, I've had the honor of working with you at Gravity for years now. I'm very, very lucky, is that Gravity finds itself in kind of a precocious spot often, where we're unearthing requirements and standards that do not just apply to social care, and they do not just apply to social determinants of health, but we're in a position to identify them and create guidance regarding them because of our, our place in the standards-based ecosystem, and because of our commitment to doing things correctly, right? So this is a very good example of the brief that you created. I kept on citing examples of it being relevant to things like, like mental health diagnoses, or any of the different things that we screen for. If I'm a practicing clinician, there's a litany of things that I screen for in a preventative visit, a well visit, an annual wellness visit, right? So the same principles of verifying with the patient before applying the diagnostic concept that you identified in the social care, social risk diagnosis brief applies to all of that. So appreciative. Another example of like leveraging our community to kind of create common good. And so grateful for you.
Yes, and we look forward to creating more resources in collaboration with Gravity and you personally in the future, I'm sure.
I know, I can't wait. I have a list.
Well, you mentioned one of the principles of data use. Could you tell our viewers what the other data principles are?
Oh my gosh, I'm going to try to remember them. I'm going to go to the
I know I'm throwing you with this question.
I know,
we didn't talk about this one ahead of time.
Improving population health equity, ensuring personal control, designing appropriate solutions, improving personal health outcomes, ensuring accountability, and preventing, reducing, and remediating harm.
I think that sounds right.
Thank you. I'm going to go cross-check for a second. Yes.
I think that's it.
I did do it, right? And I think that the reason why we created those in the beginning really was because we recognized the immensity of what we were doing ethically early in our work, right? Bringing concepts of social context into clinical spaces. And we couldn't do it without kind of creating some core principles. We know, I want to note, especially in the last one, preventing, reducing, and remediating harm, is that in order to operate correctly under that principle, sometimes we don't make code, right? And a good example of that is our work that we just completed in the fall incarceration. We couldn't trust, and we were just talking about this in a few minutes ago on another call, right? We couldn't trust that a general history of incarceration concept would do more good than harm.
Mm-hmm.
And so we sat in our principles and we leveraged our subject matter experts, and we're actively working at how to ensure that the codes and concepts we're naming to tell critical patient stories are aiming for the good, right? Towards personal outcomes, towards population health equity, towards preventing, reducing, and remediating harm, right? So I think you can testify that we apply these principles in design, in build, and in implementation as well. And again, that's how it came back to the brief, right? The brief was an example of us applying our principles in our resources that we use for implementation and dissemination.
All great points. And I think the industry could be, feel very trusted that this organization is really doing the right thing, thinking through all of these potential issues, and that a lot of people wouldn't even consider. They would just think, oh, just make data standards for everything. But being able to think through, there might be times when it's not really the right thing to do, or how could this be misused? So all great points.
And I just want to note that, again, it's because of the we in Gravity. Like, I'm here today. I'm honored to be here. Gravity, co-founder, director of terminology. I work with a community, right? And we collectively over time, like we ensure, we haven't talked about governance yet, but we ensure at Gravity, a little bit we did, I think, we ensure that we have representative voices in our governance and ensure therefore that patients are centered in that work, right, of governance and deciding what we do. And we also ensure that patients are centered and compensated in our work streams, right? So our terminology work stream ensures that we have experts from across the ecosystem and patient experts who are compensated to come and represent lived experience so that we are not just hypothetically and conceptually applying principles, but centering patients in design. And that's been a really critical and beneficial facet of our work from inception.
Well, that's a great lead into my next question.
Oh,
Since you mentioned the whole collaborative community and the governance and how that all works. So how, if someone is interested in getting more involved in Gravity, how can they do that?
It really is a kind of a, again, I'm a child of the 70s, so I'm going to use a choose your own adventure novel analogy because they were all the rage when I was a kid growing up. And so it depends on how you want to participate, right? The easiest thing to do is just write an email to gravityproject@hl7.org, introduce yourself and how you want, like what your interests are. And we'll literally respond to you and just try to engage and figure out where we can find you a place within the work streams in the community. So it's that simple. You can also go, if you just type in Gravity Project HL7, you'll get to this place called the Confluence. It is a little overwhelming because Sue and I just talked about all the things we do. It's a lot, right? But that's a good view of all of the things going on. And if you just look at the meetings tag on the Confluence, it shows you all the meetings you can join, right? So Gravity has, our governance meetings are private, but our public meetings are by definition public, right? So we have public open consensus processes and public open consensus meetings across our 3 work streams. Terminology, the one I have the honor of spearheading. Technology, my friend Corey Smith helps lead that. And then implementation, which is an all community initiative. And that actually is led in kind by our friends at Civitas Networks for Health. Right, so those 3 work streams have public meetings, so you can write the email, look at the Confluence, connect to a meeting, and at any time start to just by osmosis take in the kinds of conversations we're having in our work. Again, terminology, talking about developing concepts for critical domains, everything from developing HICPIC concepts for food as medicine initiatives to developing terminology to name toxic stress physiology. This is all stuff we're working on right now. And in technical work streams, they're talking through the ways we share information, right? So not the actual codes, but how we share it, what are the requirements, and sharing information across clinical and social care and human services situations, all the consents and details on that. Fascinating, right? And then implementation, we just talk about what we're doing, right? So our implementation affinity meeting is meeting quarterly this year. Our next meeting it's at the end of like an off-cycle course. The next meeting is the end of May, which is very, very shortly. And in that, we're talking about return on investment, right? So Gravity is now, terminology and standards are now implemented across the nation. So it's time to talk about what are we getting, right? So we focus on topics of like decreasing patient and provider burden, or outcomes analysis, like improving health outcomes, improving social care outcomes, right? So those 3, there's literally a myriad of different ways, everything from emailing to casually viewing the Confluence to joining a Gravity meeting. And all of those apply to whatever bandwidth you have, and we would certainly welcome you. Gravity is a large community and a very, very dear family, and the tent and table is always ever expanding.
Well, and I can vouch for the fact, as someone who's attended a lot of those different meetings, that they're all excellent. The expertise of the people who participate in these meetings is just amazing. And I don't think I've been to a single meeting where I haven't learned several things. So it's just a wonderful way to really understand this space a little bit better and just be amazed at all of the work that's going on.
You are a critical part of that, Sue. So thank you so much. I just wanted one comment on that I think is important. It's rare to have such a diverse community, I think. So oftentimes within our own area of expertise, we work within the silos of our stakeholder group, right? So coders meet with coders, and payers meet with payers, and vendors meet with vendors, right? So Gravity by Design is not that. So it's actually a really fun seminar. So that idea of like learning, I'm always learning too, right? Because we're constantly gathering with diverse voices to address common problems. So it's inevitable. You're going to walk away from a meeting with a perspective that you didn't have before. So it's incredibly valuable on that point. It's kind of rare as like a multi-stakeholder initiative.
That's a great point, because it is very diverse, and it's just amazing some of the different perspectives that people bring to these meetings.
So fun. Yes.
Well, before we close, is there anything else you would like to share about the Gravity Project and its work that I haven't asked today?
I think it's hard because we've actually covered a whole lot. I think I just want to reiterate some things that we've said and we're just saying. Like, if you listen to this podcast, the thing I want you to hear the most, and Gravity would want you to hear the most, is that you're welcome here, right? As technical as some of the conversations we've just had are, and as technical as some of the conversations we have in our meetings are, there is not a single type of expertise or insight that is not helpful. And so we want to hear from you. We want you to be part of solutions we're making. We even often have like ad hoc side meetings to ensure that non-technical expertise and voices are like implemented by design into our solutions. And so if there's any point that's salient, is that please come join us. The door is open, the meetings are open. We would love to have your expertise. And it really is this kind of resilient, vibrant community working on perpetual problems. And we would be better for you coming, whoever you are, for coming to join the family.
Well, and AHIMA has really enjoyed being a member of the Gravity family and participating in its work and working with you in particular. It's just been a wonderful experience, and we're very happy that we've been involved in that.
I am too. Lucky us.
And we look forward to many more projects, initiatives, briefs, and other resources and things that we can be involved in the future, I'm sure, together.
So excited. Thank you so much.
Well, thank you for joining us today, Sarah, and sharing your insights about the Gravity Project and its work. This has been a really great discussion. So thank you again.
Such lovely. So anyway, I appreciate AHIMA.
And we appreciate you.
Thank you so much for your time.